COVID, I think, raised the profile of supply chains in a way that it has not been raised globally ever before.
We have a gold mine of data in the supply chain, or especially in the health supply chain.
An ideal situation would be localization.
For me, the desirable outcome to everything we're trying to do in health supply chain in Nigeria is to reduce maternal mortality rate, infant mortality rate.
We're at a really great time right now because people during COVID realized how important supply chains were. Maybe not for health, but they couldn't get their toilet paper. There were so many things that didn't work with supply chains, and they realized that supply chains are the backbone of our daily lives. I do think we have an opportunity right now to build on that awareness, to drive home how important supply chains are in helping us achieve health outcomes.
I think one of the key things that we can do now, realistically, is working together, collaborating together with other NGOs. Issues of rupture in the supply chain can be fixed by combining resources, combining information, sharing details of stock availability, meet the needs of the beneficiaries whilst also cutting costs and reducing waste.
What I would like to see a better use of data. If we had the right tools, if we had the right input, if we had the right tracking, we definitely could benefit from this data to forecast better, to plan better, to standardize probably some of the requirements.
COVID has taught us that we were centered in specific locations. We were all going to specific locations around the world, and we saw how that impacted our supply chains. So then how do we diversify that? Are we going to go to look for foreign markets, and what can we do within our own local markets to improve their capacity and capability to support our operations?
In the last, I think, decade or so, we've been championing globalization. So we relied a lot on imports. We stopped manufacturing locally, and even if we were manufacturing, we were not manufacturing adequate quantities. And this meant that when every country went back to look internally and sort out their problems, we had nowhere to import from. Now, an ideal situation would be developing homegrown solutions. Definitely not 100%, but begin thinking of processes that we can begin to cater for ourselves with whatever resources we have.
What I really like to see is seeing the organizations, the institutions investing more in the supply chain preparedness, supply chain resilience before the disaster happens and before the emergency happens.
We would have more relevant investments in supply chain. There are many governments, donors, partners that have invested in supply chains over the years, but I think it hasn't been holistic. It hasn't been around understanding, here's the strategy for our supply chain. Where do we want our supply chain to go? Looking end to end, looking at where the capacity is, where the gaps are. A lot of the investments have been made from unique perspectives, not holistically.
When you have malaria commodities in the country, you don't just want it because you want malaria commodities. You want the woman in the village, in the remote area, to have access when she's pregnant, or else she may bleed out. And those are the things we face every day. Every effort, all the investment, whether by the country, whether by donors, if they can actually reduce our maternal mortality rate, infant mortality rate, these are avoidable. If we can tackle that, then it will be a good day for me.